Hi, my name is Carly Lewis, and I'm going to be the nurse taking care of Francis Mishu today. His MRN is 404929. His date of birth is 4/13/1939, and he is an 81-year-old male. He has no known allergies. Mr. Mishu was admitted to the USM hospital with a small bowel obstruction. He has NPO and has an NG tube in place on low intermittent suction. Over the past 4 hours, Mr. Mishu's NG tube has put out 600 milliliters of dark bilious fluid. His serum potassium level is 3.2 MEQs per liter. The serum potassium is low, as we like it to be within 3.5 to 5. He has a peripheral IV in place, and I'm going to assess that. So I'm going to do some hand hygiene. I'm going to put on my gloves. And I'm going to assess the IV. As you can see, my patient's IV is patent and intact with no signs of phlebitis, infiltration, redness, swelling, or discharge. I would ask the patient if there is any pain. In my med room, I'm going to assess my patient's orders. His maintenance order is 1,000 milliliters D5 half normal saline IV running at 90 milliliters per hour continuous. I'm just going to check that against the NUR, which is correct. My patient has 2.2 liters of fluid, which is within the range of 2 to 3, so it's adequate. My patient is not receiving any potassium, so that's inadequate. And my patient is receiving 169 MEQs of sodium, which is over 100, so he's receiving adequate sodium. As you can see, my patient is receiving adequate fluid and sodium intake, but inadequate potassium, so this needs to be addressed with the physician. Now looking at my replacement order, my patient has 1,000 milliliters of D5 half normal saline with 20 MEQs of KCl. IV for NG replacement 1 milliliter to 1 milliliter Q4 hours. And I'm going to check this against the NUR, which is correct. My patient lost 600 milliliters of dark bilious fluid, so we need to replace 600 milliliters within 4 hours. To figure out the rate, I took 600 milliliters and divided by Q4 hours, which gets me 150 milliliters per hour, which we'll be replacing. My patient is receiving 3.6 liters of daily fluid intake, which is inadequate as the daily fluid intake should be 2 to 3 liters. My patient is receiving 72 MEQs of potassium, and that is adequate because the range is 40 to 80. And my patient is receiving 277 MEQs of sodium, which is adequate because it should be over 100. So my patient is receiving inadequate fluid intake and adequate potassium and sodium. However, my patient is receiving the wrong solution. Anything below the pylori should be replaced with isotonic solution. So he should be given LR or saline with bicarb. At this point, I would need to call my provider with an SBAR. And with the new orders, my patient should receive adequate daily fluid intake, potassium, sodium, and the correct solution. I'm going to check the new orders that the doctor has given, and I'm going to go check on my patient. Thank you.